Thanks, David. Thanks to everyone who's joined us today. It's an absolute pleasure to be able to share my story. I'm going to have to get into it pretty quickly because I only have 5 minutes to kind of give you the essence of how psychedelics have helped heal me from my trauma. I'm a veteran. I served in Afghanistan in 2009. Unfortunately, I witnessed multiple traumatic sort of instances, and the main one was seeing my friend get shot through the face, Martin Kingett. Unfortunately, because that was only 4 months into the tour, you remain out there, and this energy that you cannot grieve kind of gets trapped inside of you. And if anyone's read Waking the Tiger, it's this energy that if it's not allowed to flow, or it's not grieved, it will stay with you and alter your life in many different sorts of ways. So coming back from the military, I tried to get help through the military. I went to the medical officer, who told me that I was just demotivated in my work role and that I would figure it out, in terms of I was very tearful and couldn't push these sorts of images out of my mind. So I left the army, couldn't deal with it, and I went to do party seasons. I did snowboarding, surfing, anything to sort of get out of my mind. So I used the analogy that my mind is like a house, and I wasn't comfortable in my house. There was no nice furniture to sit down in. I was ruminating, and I was just trying to exist outside of it. Finally, after 4 years, I returned home to sort of face my demons. It was clear at that point I had no drive, ambition, or purpose in life. I was staying on my friend's sofa. And at that point, I had to ring the Samaritans. I thought I was going to take my life at that point. But then something clicked. They told me, like, is there something that you can do yourself? And I thought, if I'm sitting on this sofa, I'll turn on TED Talks and I'll look into depression. And one of the videos that came up, Excuse Titles, was by Rosalind Watts. And then I watched one by Robin Carhart Harris, and then another one by Ben Sessa. And I was like, okay, so psychedelics might be able to help me in a more holistic way rather than meeting with a therapist and it taking years. And I began to understand that there was a basement in my house that was just full of demons and shadows, and potentially these psychedelics helped me go into that basement and get comfortable with these demons and shadows. At this point, I'd messaged Ben Sessa, who told me, if you want to help understand yourself and help this community and the research, go off to university and study it. So now I'm at Roehampton University studying psychology and counselling. And over the past year, I've been dealing with my own issues while studying, which is a really cool sort of way to understand PTSD whilst at university. It's been a pretty good experience. And alongside university, I was looking at the MAPS website. I was looking at psychedelics, mushrooms, and how they're meant to be used in a therapeutic way. And it was when I went off to Scotland, I went foraging in a forest for these mushrooms. I couldn't find any. During the day, I'd been working up at a pop-up coffee stall outside a whiskey distillery. And one day when I was really bored, the sun just shone down onto the field that I was working in. And I just realized the whole field was full of psilocybe mushrooms. And every 4 days I ate them, and I was out in nature and I was by myself, which I don't always recommend, but it worked for me. And I had a great experience on them. And then I went off to Barcelona and used a guide with LSD, which was the most exhausting trip of my life. It lasted 12 hours. I really battled with my demons. The guide was amazing. And I had this moment which just seemed like, like on a safe, that final click, and that everything just opened. And if anyone's read John Donahue, it was a rebirth. I was just showered in like self-love for myself, a concept which I'd hated before and never understood. And I just saw my trauma and it was laid out and it all seemed to make sense. But the only thing that didn't make sense was to carry that around with me anymore. And I left that trauma in Barcelona. And I made friends with the demons in that basement, and then the rest of my house started to look nice. And then I had access to a loft, which was the birth of my creativity. And now I write fiction, and I have time to dream, and it's just a really positive spin. It was all, like Carl Jung says, enlightenment, if the man does not become enlightened by staring at beams of light, he becomes enlightened by making the darkness conscious. And that is literally perfect words for what happened with me on psychedelics. The whole narrative changed in my head. It was not, I don't like myself anymore. It's like, you are worthy, you are loved, and you love outwardly. Coming home, my ADD problems at university fell away. My relationships with my friends were more honest, they were more deep. Again, I felt loved by my friends instead of leaving a social situation and just feeling like I had no one. And after this breakthrough, I returned to England and I was just messaging everyone again, researchers, Ben Sessa, Robin Carhart-Harris. I was like, please just let me be a part of a research team. I know this is like the most amazing work, and it's just, I want to be a part of it. Even if I'm a water boy, I'll make cups of teas. And Robin put me in touch with Keith Abraham, who was setting up Heroic Hearts Project, the UK version, which is a charity now that connects veterans with plant medicine. But unfortunately, because it's illegal in this country at the moment, we have to travel outside of the country to do it. And this charity funds veterans' trip to the medicine, which is just amazing. And meeting Keith and everything's just seemed to align, and it's been such a powerful friendship already. And just to wrap it up there quickly, I'd just like to say that I believe that everyone should have access to this medicine, even if you're not mentally ill. Once the time comes and it's been researched and we understand how to use this in a powerful way, I think everyone can benefit from the medicine in some sort of way. And I just want it to be equal for everyone, equal opportunity. We shouldn't have to travel to Peru. People in this country should have access to it, and I think it's just so important. And it's just amazing to be part of this team, Drug Science in the working group, and to be part of a talk which, there's people in this talk that I was looking at from that sofa when I was depressed on TED Talks, and it's just amazing to be a part of it. So thank you very much.